My career goal with dance is to be on Broadway. I have been dancing since I was 3, and I just immediately fell in love with it. I was in pain for a good year before I found out I had hip dysplasia, but I just never thought anything of it, just because I have a lot of pains as a dancer. Hip dysplasia is like when your socket is very shallow, so your hip kind of just is like rubbing kind of, and it gives you a higher chance of popping out of place. They usually find it in toddlers when they're learning how to walk because their hips will slide out because they're not strong. The muscles aren't built up. It's not very common you find it in teenagers, and if you do find it, it's usually not both, it's just the one. But I just happened to defeat the odds, and I had it as a teenager and I had both.
We ended up getting a referral to see Dr. Meredith at University of Maryland, the Rehab Institute. And we did some x-rays and some follow-ups, and then he also had her go through some physical therapy to see if that would help with the pain and discomfort, and eventually it did not, and then that's when he recommended us to have a consult with Dr. Nascone.
Our first visit was actually telehealth.
It was a telehealth.
And I remember thinking, oh my gosh, she's gonna tell me I need surgery. And he ended up telling me I did need surgery, but he was very nice and encouraging me that it would be okay and I'd be able to get back to where I was. Well, I had surgery, my first surgery on my right hip was in December. And I wasn't really knowing what to expect, but the team there was just very comforting in the fact of, we get you whatever you need type thing. They just made sure I wasn't in so much pain, walking me through every step of the way. I had my second one in March. Yes,
it was
March.
3 months, almost to the day.
Yes, it was just one day off. And I knew what to expect this time, and I had known people down there, and I was like, oh, hey, and they were like, you're back, nice to see you again, and I was like, yeah.
I felt like we were in amazing hands when we were in Baltimore. It just made me feel like I was getting the same care that I had experienced down here on the shore. It's been really, really amazing in the fact that we've been able to stay on the Eastern Shore and been able to do a lot of the follow-ups and all of her post-surgical care right here in Cambridge.
I'm kind of in the in-between stage of recovering. I've been released to do like small jumps, but I haven't been able to be like tumbling like I used to yet, just because I'm still healing.
I want her to just get back to being a teenager and enjoying, you know, the rest of her high school and being able to pursue her dreams of being a star on Broadway someday.
In 6 months, I'm hoping to be fully back to where I was. Dancing, tumbling, hoping to go back in for auditions, back to where it was and pretending this never happened.